Assalamualaikum. I'm Rasmia Pendi from DSP2B. So, now I will tackle to you about negative symptoms of schizophrenia. Number one is avolition, combining the prefix meaning without and volition, which mean an act of willing or choosing or deciding. Avolition is the inability to initiate and persist in activities. People with these symptoms and persist in activities. People with these symptoms or apathy show little interest in performing even the most basic day-to-day function, including those associated personal hygiene. So, what I understand here is sila yung mga walang interest sa mga gawain. It is a total lack of motivation that makes it hard to get anything done. So, ito yung mga walang interest, walang pakialam kung ano ang nangyayari, no? Number 2 is alogia. Alogia, derived from the combination of without and logos, means words. Alogia refers to the relative absence of speech. A person with alogia may respond to questions with brief replies that have little content and may appear uninterested in the conversation. Alogia is a lack of conversation or poverty speech, which is example yung may kakausap sa akin. How old is your children? So I will say 9 and 12. Even though if a normal people say, magiging excited siya kasi proud siya na may anak siya, diba? She will say, my eldest daughter is 12, she will show bright, maganda. And my youngest daughter is beautiful also, so 9 years old. Diba ganun mahaba magkipag-usap ay isang normal na tao. Number 3 is anhedonia. A related symptom is called anhedonia, which derives from the combination of without and the word hedonic, means pertaining to pleasure. Anhedonia is the presumed lack of pleasure experienced by some people without schizophrenia. And anhedonia is inability to feel pleasure, or kahit anong gawin mo, hindi siya magiging masaya. Parang ganun ang anhedonia, ganun ang pagkaintindi ko. Next is blunted affect. Refers to a lack of outward expression of emotion. A person with these symptoms may stare vacantly, the muscle of the face motionless, the eyes lifeless. When spoken to, the person may answer in a flat and toneless voice and not look at her conversation partner. Emotional blunting. Patients with blunted affect have difficulty in expressing their emotions. These patients, difficulties in expressing their emotions. Yun ang sinasabi na yung parang kakausapin ka na vacantly, look at you, tapos ialis din ng mata, and then when you're talking to him or her, yung nakatingin lang siguro sa baba, and then kung magsalita, hindi masyado marinig, walang emotion, walang feeling, yung parang hindi mo kausap, parang hangin lang ang kausap mo. Asociality, these symptoms very similar to avolition or related to anhedonia. However, asociality meaning without and social meaning relating to society or its organization has been recognized as a separate symptom of schizophrenia spectrum disorder. These symptoms capture a lack of interest in social interactions. Unfortunately, these symptoms can also result from or be worsened by limited opportunities to interact with others, particularly for severely with patient. Ito yung mga taong ayaw sa iba, ayaw makipag-usap, yung ayaw magkaroon ng close friend, ayaw magkaroon ng interaction with others, no? It is a reduction in social initiative due to decreased interest in forming close relationship with others. Like I said, kaya niya maging close sa ibang tao. Next is treatment to schizophrenia. Number 1 is medication. When you say medication, di ba ang sinasabi is gamot. Gamot. It is antipsychotic drugs, also known as neuroleptics, are class psychotic medication primarily used to manage psychosis and principally in schizophrenia. Ito talaga yung ginagamit sa may mga sakit na schizophrenia, yung antipsychotic drugs, no? Then, we have two ways of medication. This one is the first generation antipsychotic drugs and their side effects. Are those broad classes of medication that were first to be discovered. Ito yung pinakanaunang na-discover nila na gamot for schizophrenia. These drugs can reduce the positive and disorganized symptoms. So, this medicine, no, these drugs, pwede daw lumakas yung pagkakaroon niya ng positive and disorganized symptoms, no, of schizophrenia, but have prescribed. They are not cure. Hindi daw ito yung totoong gamot. Ano kayong gamot? The common reported side effects of all antipsychosis include sedation, dizziness is nahihilo, blurred vision yung malabo ang paningin, restlessness, paggabalisa, and also the sexual dysfunction. Ito yung sexual na pag-dysfunction ng iyong kwan. Basta. When you say sexual dysfunction, is like persistent, recurrent problems with sexual response, desire, orgasms, or pain, no? So, we will proceed to the first generation antipsychotic drugs, no? I have researched generic name of drugs, antipsychotic drugs, which are chlorpromazine with a trade name of Thoraxine, flufenazine decanoate, which is trade name is Prolixin, and Haldol, haloperidol, trade name Navin, Theotexine, which is have a trade name Stelazine, and also generic name of trifluperazine. That's all antipsychotic drugs first generation. So we will proceed to second generation antipsychotic drugs and their side effects. In this, it was clear that these drugs did not help everyone, and they produce troubling side effects. It works by blocking the excitatory activity of dopamine and serotonin chemicals or neurotransmitters released by nerve cell to transmit nerve signals. So, sa aking nabasa is second generation antipsychotic drugs gives them a lot of side effects, no? Imbis na gusto nilang magamot, no, mas lalong lumala kasi yung mga side effect ng gamot is lumalabas sa kanilang katawan. They can do ginagawa niya ito, no? They are ang ginagawa kasi ng mga antipsychotic drugs is ginablock daw yung parang excitatory activity ng serotonin at dopamine, which is neurotransmitter, and release to nerve cell para matransmit ito sa nerves, which is released by nerve cell to transmit sa nerve signal. So parang ito yung dahilan kung bakit sila nagkakaganon, no? There is also medicines. I have also researched medicines, generic names of medicines na second generation antipsychotic drugs, no? We have clozapine, trade name Clozaril, aripiprazole, trade name Abilify, olanzapine, trade name Zyprexa, risperidone, trade name Risperdal, ziprasidone, trade name Diodon, and the last is quetiapine with a trade name of Seroquel. So next is the side effects of the medicines, of the drugs. I had column side effects, first generation, second generation. So which means sasabihin natin kung may side effect yung first generation, second generation, kung lumalabas ito sa first generation at second generation. So extrapyramidal signs. Extrapyramidal signs is yung you can't control yourself, no? May gumagalaw yung sarili mo na you can't control it, hindi mo kinokontrol, which is it has a side effect, no? Meron ang first generation, second generation. Next is drowsiness, sedation, or fatigue, which is na meron ding side effect, which is nandoon din sa gamot ng first generation and second generation. Blurred vision, pagkalabo, which is andun din sa first generation na gamot and second generation na gamot. May side effect lahat, no? Weight gain, nasa second generation. Restlessness, yung sobrang pagod, nasa side effect ito ng gamot na first generation. Dizziness, pagkahilo, nasa second generation. Sexual dysfunction, nasa first generation. Dry mouth, nasa first generation. So, we stop sa tachycardia. It is nasa second generation siya. May side effect yung gamot na tachycardia. Constipation, which is pagtitibi. It was in first generation. Nasa gamot na first generation. Nausea, pagduduwal. It is in second generation. Insomnia, yung hindi ka makatulog, nasa second generation. Headache, sakit ng ulo, nasa second generation. And urinary incontinence, no? Parang wala na yung hindi ka na makapagpigil ng ihi. Wala nang pumipigil sa ihi mo. That is nasa second generation. So, what I've said, no, mas maraming nasa second generation na mas marami itong side effects, no? Kaysa sa first generation. So, kaya nga siguro sinabi nila na yung second generation antipsychotic drugs ay hindi nakatulong sa marami. Mas lalo pa itong naglala. Kaya, they prefer na first generation ang nakakatulong, no? Number 2 is psychological treatment. We had also a treatment sa mga schizophrenia, no? A review of 37 prospective studies of people after their first episode of schizophrenia found that combination of medication and psychosocial treatment predicted the best outcome. Mas maganda daw na mas maganda daw na dalawa yung gawin, mag-medications and a therapy, no? Number 1 is a social skills training. Is a design to teach people with schizophrenia how to successfully wide variety of interpersonal situations, discussing their medication with their psychiatrist, and practicing basic skills in life. In social skills training, parang ang tinuturo sa mga basic lang na ginagawa sa buhay, like ordering a nice restaurant, no? Yung mga basic lang. Pagbasa sa mga bus, kasi not all times na may kasama sila, no? So, they must have learned how to do a basic skills in life, no? Kahit na yung mga pagbasa lang ng mga paunting-unting words, no? Family therapists. There are also therapy na kailangan ng pamilya. Many people with schizophrenia live with their families. Karamihan daw sa schizophrenia, kasama rin ang pamilya and not hospitalized. Earlier, they discussed research showing the high levels of expressed emotion within the family. No, mas na-express daw nila ang emotion niya kapag kasama nilang pamilya niya, no? Including being hostile, critical, and emotional over-involved have been developed. There are techniques, no? Techniques or strategies. Number 1 is education about schizophrenia. Yes, the family must know what is the ill of their loved ones and what is the very good way or cure that they can do to their loved ones. Information about antipsychotic medication. Yes, they have to know what is the antipsychotic medication, which is has some side effects to them, no? Kasi what if they will have their disorganized behavior, no? Tapos the loved one will react over, no? Kailangan kasi they will understand the reaction, what are the reactions of the of the mentally ill. Blame, avoidance, and reductions. So, what is said here is, kailangan kahit anong mangyari, wag silang sisihin, no? Kasi kasi pag sisihin sila, yung sakit nila na trigger, no? You have to learn, they have to learn how to handle the situation, no? Communication and problem solving skill with the family. This is the problem. So what if there is something going on bad to the family? So the family must explain to the person which has schizophrenia, must explain well, yung walang galit, yung magandang maintindihan nito ng mga ayos. Social network expansion. Dapat it also has a dapat may alam din sila about sa mga social network expansion. Number 6 is a hope, yung pag-asa na gumaling sila at yung pag-asa na hindi na sila dapat ma-hospital. Next, we will proceed to the treatment. Letter C, cognitive behavior therapy, is a short-term problem-focused approach with the goal of teaching people who have schizophrenia a variety of coping skills to help them manage difficulties. This time, this is a cognitive behavior therapy. So, the psychiatrist, the therapist will talk to the patient, and then they will talk about what is happening. It will explain to her or to him what is going on to his body and to his mind. Why is that doing, no? Parang psychoeducation din, no? Letter E, cognitive remediation therapy, is a design to improve neurocognitive abilities such as attention, working memory, cognitive flexibility, and planning, and executive functionality, which leads to improved psychosocial functioning. Cognitive remediation strategies, sometimes referred to as cognitive rehabilitation, are behavioral intervention to help to improve cognitive function through the use of repetitive exercise and positive reinforcers, such as praise or tokens for participation and increasing. This is a therapy which is ang kanilang gusto is yung attention, yung di ba when a person has schizophrenia, yung attention niya malawak, wala siyang attention na straight to the point, na attention pala sa kanya, walang ganun. So what we'll do in cognitive remediation therapy is they were training siya, tinitrain yung attention na maging focus sa isang bagay. Also his mind, no? Her memory or his memory is training also. So in cognitive remediation strategy, sometimes it is a rehabilitation. So kailangan niyang magstay sa isang place where na kung saan siya magte-therapy, no, para makafocus siya on the therapy. Residential treatment is often the best choice for schizophrenia. Totoo, the best choice daw. Long-term intensive care helps you or your loved one learn to manage this condition through therapy. Yes, it is a therapy na which is intensive. So, intensive means intensive. Intensive means masinsinan na panggagamutan, no? Which is focusing to one, and also it is doing group session, so yung pangmaramihan na which is nag-session kayo for therapies. And also it is you are trained also in social, no, pakikipag-interaction sa iba para malaman mo kung ano ang pwede mong gawin sa buhay, no? And also in that therapy, no, you are isa kang alternatibong sinasaayos at minsan pinapractice nila na what if yung may nangyari na ganon. So, the therapist will try to practice you, no? Will try to practice you how will you do if there is something happen. So, that's all. Thank you.